Hey everyone, welcome back. This is Dr. Perry from the Pain Laser Center coming at you. And what we're going to talk about today is ankle joint restriction and the key pivotal role that takes in regard to your whole kinetic chain, which is actually how your body functions as a unit. So with therapy, you have to really look outside the proverbial box, and then with laser therapy even more so. So one of the key places that I look at, and you should look at too, is I'm going to show you how you can do this at your home to check it. Is if you have chronic pain in your knee or your back or your hip, look down into your ankle joint. I'm going to show you an easy way to assess that and a very easy way to work that joint. Make sure you do both sides, which is bilateral, right side and left sides, just to check them. You only have to do it a couple times a week, and then once you get normal motion back, just stay on top of it and periodically check it every now and then to keep some good motion in that ankle joint. So sit back, we're going to show you a video on how to do that. If you have any questions or comments at the end, you feel free to give me a call, send me an email, you know the drill, and I'll be happy to talk to you a little bit further. And so until then, this is Dr. Perry from the Pain Laser Center. We'll catch you on the other side. Okay, everybody, welcome back. I'm at my FMS functional movement screen room here at my office. This is where we do the movement assessments on how well my clients move and function in regards to joints, muscles, things like that. So there's more information about that on my website too. But I'm going to show you exactly how we take a look at the ankle here. And there's a specific move that I teach everybody, and then it frees up the ankle more that's in front. If you have some pinching when you do this move, that's okay. It just means that you need to move into it a little bit easy. When you do this movement, do 8 to 10 repetitions on it, and it's designed in a specific way where you can use pretty much any stick that you've got, or any pole. You can use a broomstick, wooden stick, a barbell, stuff like that. This is one of my functional movement screen sticks here that we use to measure different things. But I'm going to show you how we do this. I'm going to show you on my left ankle. You want to make sure you do this on both sides. And you can have it with shoes on or without shoes. Really doesn't matter, whatever you want to do. You don't always have to do it in a kneeling position. You can do it in a standing position, putting your foot on something. But I just like the kneeling position because you can also work your hip flexor on the opposite side with it as well. So I'm going to show you how we do this on the left side. So if you come into the kneeling position here, you're going to put your foot up and out, take the pole, put it on the outside of your little pinky toe, not on the inside, on the outside, okay? And from here, on your opposite side, you're going to be stretching your other hip flexor. And in order to relax that hip flexor, what you're going to do is just contract your buttock muscle on the right, because they're neurologically linked together. And the way that you can do that is just push your right knee into the floor. When you push your right knee into the floor like you're driving it down to the ground, you'll actually feel your buttock muscle contract. So you do that. Then you're going to take your knee on this side, put it on the outside of the pole. And you're going to just lean forward, hold on to the pole, lean forward, and go as far as you can with your knee over your toe. And you want to keep your back heel on the ground. You don't want him to move up. As soon as he moves up, you stop. Okay? Ideally, you want to be able to get your knee about 4 inches out over your toe before your heel raises off. If you stop before that, that just means that you don't have proper joint motion. And the reason we put the knee on the outside of the pole is to prevent your foot from flattening out or caving in, and that's going to give you a bad foundation with what they call flat feet or pronation distortion syndrome. So this prevents your foot from falling in. It's impossible for your foot to fall in when you put your knee on the outside. So you put it on the outside of your pinky toe, holding the pole, lean forward. As soon as you feel your heel start to move off the ground, you stop, you come back, you move forward again, hold 1, 2, 3, come back, move forward again, hold 1, 2, 3. Do about 8 to 10 repetitions. Remember to squeeze your buttock muscle on the right side by driving in your knee to the ground. Then all you got to do is just switch over, put this knee down, put that foot forward, put it on the outside of your right toe. Right knee goes on the outside of the pole. Then lean forward. Make sure your heel doesn't come off the ground. It comes off the ground and you stop. Hold into your pole, come back, and then lunge in again and back. Driving the left knee into the floor, squeezing your glute. You'll notice a huge difference when you do this. And if you're a runner, in your movement, and your power, your speed, everything. So remember, try this for a couple times. You'll really see a big difference on that. Contact me through my website if you want some more information. And I hope you enjoyed the video. We learned a little bit of stuff tonight. This is Dr. Perry from the Pain Laser Center. We'll see you next time. Have a good day.